Hi there, I'm Coby Langford, Osteopath here at soothclinic.com. Welcome to Sooth Clinic. If you're new to my channel, remember to subscribe and click the little bell button so you don't miss out on any exciting videos. Not that back pain's that exciting, but interesting videos. Okay, so today is Q&A day. So I've got a few questions here on my phone that you've sent in on the videos this week, so I'm going to start answering them for you. Okay, so the first question is from Kirsty McFarlane. Hi Kirsty, you always sending me lots of messages, so nice to answer a question for you. You left this on the evening yoga program video, and you said, before I did the back stretches, I was stretching my upper right arm across my body, and the pain in my lower right back was exactly the kind of pain I get all day, every day. Any idea what is wrong with my shoulder arm that is causing my lower back pain? So I presume you mean this movement, similar to that, or any kind of rotation. So this is not a diagnosis. I can't possibly hope to give you a diagnosis on the internet, but I can tell you anatomically what that sounds like. So crossing over and causing low back pain, that does sound like a tight QL, quadratus lumborum. So if you want to, and also possibly rib, but I think we'll go with quadratus lumborum. So yeah, just look into some nice stretches for QL, which is commonly really, really tight if you have weak core or if you have chronic low back pain. Okay, so this next question was left by, I hope I'm saying this right, Nguyen Tin. Sorry, I don't know how to say your name. Hi there. This was left on the core activation video. It's super illustrative and helpful in identifying what the core muscles are, blah, 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 sorry. Thank you. A question is, when contracting and lifting my pelvic floor, I have a feeling of urinary leak. Such a feeling is a real hassle for me. Anything wrong? Any suggestions? Okay, so one of the main reasons you do pelvic floor exercises is to actually stop urinary leak. So I wouldn't worry too much about it. I would just see it as a sign to keep going with the exercises and really look around for lots of pelvic floor exercises that you can do to strengthen that pelvic floor. Okay, question number 3 from Varun Seth. Hello Varun. Hello Coby, I follow your videos. I have a disc bulge in L5-S1. The MRI report shows annular tear and mild posterior disc protrusion, intending the thecal sac. I think that means indenting on the thecal sac, and causing mild compression, which causes pain in the left side of the lower back. Please suggest me something. Okay, well firstly I would suggest that you watch my playlist on disc injuries, rehabilitation. But just to give you my overall, everybody always asks me these questions, the same question: how can I help my disc? How can I help my disc? And the thing is, the advice we give for disc injuries is the same, because the thing about the back is we've all got exactly the same anatomy. We've got exactly the same muscles, exactly the same discs. Yes, they're kind of all degenerated to different degrees, and different muscles are tight, and the imbalance might be slightly different. But the back is really quite predictable, and in that sense it responds to the same advice. So my standard, general, basic, universal advice if you have a lumbar spinal disc bulge is as follows. Number 1, don't sit too much. You need to alternate between standing and lying, because sitting is when you put the most pressure through the discs, causing the discs to bulge out, and that stops the healing process of the disc. So really try to avoid sitting as much as you can. If you have to sit, try and get one of these foam cushions that with a hole in the middle that your spine can drop into, or sit at work on these inflatable exercise balls. They're really good. So avoid sitting. Absolutely, without fail, avoid heavy lifting. Lifting is incredibly irritating to bulging discs, and to take that one step further, you must avoid lifting and twisting. So imagine picking up a washing basket from the floor and twisting to put it onto a table. Just always keep the load, obviously you can't never lift anything at all, but just always keep the load really close to your body. Number 3, activate your core stability. You absolutely must activate multifidus, which is the little core stability muscle very close to the spine. It's actually been shown, even though it's a muscle that contracts, when it contracts, it decompresses the discs, it lengthens it. Its action is to move the vertebrae away from each other whilst holding them contained and controlled. So activating multifidus, I would actually look into it and look up the anatomy of that muscle and any exercises you can find to activate multifidus. Also work to strengthen your abdominal muscles, your pelvic floor, and anything you can do to educate yourself on how to create rock solid core stability will really help recovery from a low back disc bulge. My fourth piece of advice is keep your upper back mobile. Now this is something that you don't really hear very often, but osteopathically, when we look at the lumbar spine, when one part of the spine, we see the spine like a bicycle chain, and if one of those links, of those chains, is broken, as in a disc is like a broken chain link in a bicycle chain. All the other links in that chain have to do more work. So the more kind of strain you can take off the low back, the quicker your disc will recover. So often you might find that, or we do find that people with disc injuries have really tight, stiff, immobile upper backs, your thoracic spine. And that just means that all the strain is going through the low back. Now the more movement and mobility you can get through that upper back, shall I bring out my model just to demonstrate? The more movement and mobility you can get through this upper back here, the less work the low back will have to do, and that will really help take the strain off the disc and encourage recovery. Number 6, I hope I'm numbering them right. I'm sure you'll all leave me messages underneath if I haven't, but number 6, I would suggest you invest in an inversion table so you can traction your spine as much as possible at home. So you strap your feet in, turn yourself upside down, and you decompress the spine, allowing the disc to move back into position. This is great for neck bulges as well, which is the next question I'm about to answer. Also, you can look, if you watch my video on, I did a review of lumbar spine, they're kind of blow-up belts, and they're called decompression belts. So I would suggest you maybe get yourself one of those as well. Number 7 is ice packing. To help a disc, I would suggest ice packing straight onto the spine. Ice on, ice off, ice on, ice off 3 times. You don't really want heat near a disc, because when a disc hits a nerve, the nerve inflames, becomes fat, and it's much easier for the disc and the nerve to make contact, and that's when you get that horrible leg pain. So ice on, ice off on the spine. On the muscles either side of the spine, you want hot, cold, hot, cold, hot, cold, alternate to activate the relaxation response through those muscles, those deep, big muscles in the back. But on the spine itself, try to avoid heat. A lot of people put heat on the spine because it feels great for a second while it's on, but then you will find that a few minutes later your pain is much worse. Okay, so ice on the spine, hot and cold either side of the spine. Number 8, hydrate yourself. Really try to increase your amount of water. It's really important to try and rehydrate those discs to keep them healthy and fit. And number 10, bit of a random one, but I think for any condition which is causing inflammation in your body, one really kind of is quite a lot of effort, but useful thing you can do is to try and avoid an acid diet. So really try and get an alkaline diet. So that means avoiding processed foods, avoiding sugars, and really trying to eat kind of plant-based foods. Anything you can do to reduce inflammation in the body will reduce your pain, your musculoskeletal pain. So that's a really good tip. If you Google alkaline diet, there's so much advice available on the internet, but really something worth considering if you're really struggling with the pain of that disc. Number 11, I do have a lot of advice for discs. Get help. Get under the care of an osteopath, physiotherapist, and get regular treatment. Osteopathy can keep your upper back mobile. It can also help you to decompress the discs regularly. An osteopath can give you an exercise program to stabilize the disc, which is really important to make sure you're working with the right muscles. Often when disc injury sufferers get these back spasms, you avoid movement, you don't know what to do, but it's really important to stretch the right muscles and strengthen the right muscles. You need to be under the care of an osteopath. If you're not, it's really false economy to not take the advice and regular advice and monitoring of a health professional, because you will end up needing their help eventually. But the sooner you visit an osteopath to get help with your rehabilitation, the more effect, the quicker and the higher chance of complete recovery you have. Really, a disc bulge is not something you want to leave to chance. And if you go and see an osteopath or a medic and they say, right, yeah, you just go off and look after yourself, you go and find someone else. You need to be under the care. When I have disc bulge patients, I see them monthly, at least monthly. Initially I would see them weekly just to help them get out of that acute pain. When they're out of that acute pain, I would see them monthly to make sure if we need to amend their exercises at all, if they're doing any, if anything's changed, it's really important. It's the best money you'll spend to see an osteopath to support you through your process. I mean, initially you definitely need someone's care for 6 weeks. I would really highly advise getting someone's under the care of someone for at least a year, at least until you are completely pain-free. Okay, Varun, I hope that helps. A bit of a long answer there, but hopefully it'll help a lot of you who are suffering with disc bulges. And last question is from somebody called Revati D. Hi there, ma'am. I like all your videos. I have a disc bulge in my neck and low back. I'm taking physiotherapy and doing a few exercises, but I still have pain and muscle spasms, so please give me some suggestions. Okay, I'm going to answer this I've obviously just answered about the low back disc. I'm going to answer this because I do get a lot of people ask me about cervical spine discs, so a disc bulge in the neck. Now this is quite tricky. Obviously it doesn't cause quite so much pain as the low back because there's not so much weight. You've only got the weight of your head going through the discs that are in your neck, whereas in your low back you've got your whole full body weight going through, well, not full body weight, you've got the whole of your upper body weight going down through it. But necks, you still need to treat it the same, as in it will really benefit, neck disc bulges will really benefit from decompression. So again, I do recommend an inversion table for cervical spine disc bulges. I also recommend, similarly like with the low back, you can get these decompression belts that you pump up and they decompress. You can also get that for the neck. You can get these little, I'll put some links below. I might even put them on my website so you can purchase them from there. I'll have a look into that for you. But yeah, it's like a pump up neck brace really, and you just pump it up and it decompresses you, holds you nice and lengthened through your neck. Anything you can do to decompress the neck. What you must try and avoid is this kind of slouch position. Again, same advice with spinal discs, cervical discs as with lumbar discs. Icing, ice on, ice off, ice on, ice off, and maybe the hot and cold around the neck. But always remember with a disc bulge, don't reduce the muscle spasm too much, because the muscle spasm around a disc is actually initially, when it's an acute problem, is really important for holding the disc in position. You often find that if you go for a massage and they completely release that muscle spasm, your pain is 10 times worse, because that disc that was being held in position by the muscle spasm is now let loose and raging pain down that nerve. So I always aim to reduce muscle spasm by about 50%, just enough to get you able to move, but not so much that the disc isn't being supported anymore. Another nice suggestion for cervical disc is acupuncture. Very effective for pain relief and gently reducing that muscle spasm. I do find a lot of people find that really helpful. As with the lumbar spine discs, when you have a cervical spine disc, it's really, really important to keep your upper back mobile, because if your upper back is solid and stiff, all your strain is going through that disc. So you really want, because when you have a disc bulge, the joint becomes really kind of unstable. So a lot of the strain when you're walking or doing movement will go through the most mobile joint, so that it will automatically go through the damaged disc joint of that. So if you can get mobility through the rest of your spine, that will really support your cervical disc bulge. And core stability also exists in the neck. So multifidus runs from the sacrum all the way up to the base of the skull. So you do need to reactivate core stability in the neck. So remember, the reason we want to reactivate core stability in the neck is to hold that disc in position, allowing the outside muscles to relax. So you're out of spasm whilst having protection, like a corset of strength around the disc, holding it in. And again, same advice for cervical spine discs. Just get yourself under the care of an osteopath and get them to oversee your personal situation to get you to maximum recovery. All right, guys, I really hope that's helped. Short and sweet, but I hope that's added a little bit of joy and quality to your life. Share this information with anyone you meet if they need it. And send me your questions this week. I'll be doing question and answers once a month. So I will pick the most interesting questions that I think are relevant to the highest number of viewers. So please send me your questions. And have a fantastic week.